Welcome viewers to Voices and Views. I'm Shankar Dev Chaudhary.
I'm Nasif Ali.
And we are going to look into the common neurological problems and at least recognize some of the symptoms. Now we have with us someone who needs little or no introduction at all. We are privileged indeed to have Dr. Borah, a renowned neurologist and chairman of GNRC Hospitals, Guwahati, a premier health organization in the Northeast. And to make things much more interesting, we have with us also an audience. We'd like to welcome our audience as well. Thank you for coming. And thank you for coming, sir. Now over to you, Nasifa, to go on with the questions, I suppose.
So we want to start with, as we know as laymen, neurological problem like other problem also takes a long time to attain the state of cure. And in your life, you have treated so many patients. So yes. Which are the most common neurological problem that you would like to tell us today?
Okay. I think for the benefit of the viewers, before telling you what are the common neurological problems, you should also know what exactly we understand by the word neurology or the nervous system. The nervous system of our body, disease of the nervous system are the neurological problems. Then what makes the nervous system? It's the brain, the most precious organ that God has gifted us. We are different from rest of the animal kingdom, not because of anything else that we have in our body, but it is because of the brain. Then brain consists of main part of the nervous system. Then we have the spinal cord. Then we have the other small nerves that comes out of the spinal cord to the different parts of the body. Then it ends in the muscles. So nervous system means the brain, the spinal cord, the small peripheral nerves and the muscles. So any disease that affects these different parts of the nervous system are known as neurological problem or neurological disorders. If we start with the common neurological problems, then for example, let us start with the brain. As a newborn, he comes out, he is born with some of the congenital defect in the brain which starts in the mother's womb. Then we know that if there is problem during birth, which is a common problem in this country, it is the brain which is affected most because of the inadequate supply of oxygen to the fetus at the time of delivery. That's why all through the country there is a campaign to have institutional delivery so that we can prevent damage to the brain at the time of birth or delivery. This damage to the brain leads to mental retardation, dullness in life and delayed developmental milestones. And many other brain problems which is so common in this country. This type of brain problem, you don't see it in developed countries where almost 100% of the deliveries takes place in the hospitals. Okay. That is not happening, unfortunately, in this country. We are trying to achieve that. The next problem that we see quite often in this country related to the brain is the infections of the brain. That's again related to the hygienic conditions, the environment where we live in, the conditions where the babies are being born. So they are more vulnerable to infections. And we must all understand that the infection in the brain is much more lethal than any other infections in the body. Diagnosis is difficult, treatment is expensive, and the outcome is very, very poor. The infection with the brain is another common problem. We call them encephalitis, we call them meningitis. These are we call them brain abscess. These are some of the common neurological problems that we see in the newborn babies, neonates and infants. After that, another common problem that affects the brain is known as seizure or epilepsy. Right. Epilepsy is a brain disorder. Living brain cells consist of about 10 billion neurons. 10 billion cells makes up the brain. These cells continuously emit some electrical impulses, sometimes for different reasons. These brain cells emit electrical impulses excessively in an uncontrolled way. As a result of that, there are varieties of symptoms, I would rather say constellation of symptoms, which are manifested as epilepsy. So epilepsy is another common brain disorder. It has got different symptoms. Probably I will have an opportunity to tell you the different symptoms of epilepsy. But this is another common disorder. You will not believe it. 5 crores people in this world do suffer from epilepsy as on today. Out of one individual out of every 10 adults after the age of 50 do get epilepsy. In case of children and adolescents, 1 out of every 100 children do suffer from epilepsy. Unfortunately, 90% of them are not being recognized by the public, by the parents, guardians, or even the doctors, because they were not trained and educated in this part of medicine. Neurology has, the awareness about neurology has come quite late. It was a hidden box. The doctors did not know about neurology. Even when we were medical students, it was the most difficult subject for all the doctors who were grooming.
So are we to understand, sir, is it because it was difficult to understand that there were less people going into that subject?
That was because it was uninteresting. We did not have any equipment or technology to know about the inside of the brain. That's why people did not go into it. So it's so difficult, so complex. You need to know about 10 billion neurons, how they function, how they manifest different diseases, and there were no technology to do that. The first machine which made things easier to understand about the brain is the CT scan, for which Nobel Prize was awarded in the year 1978. So it's not a very early technology. It came into being, it was recognized as a contribution to this world in 1978, and first CT scan machine was constructed in the year 1974 in America in General Electric lab. Now you have CT scan. Almost it has become a drawing room technology in less than 25 years, probably. Now, then the next equipment that came into being, which has revolutionized neurology and the understanding of its different problem, is the machine called MRI, magnetic resonance imaging. The two scientists who had invented this technology, they were also awarded the Nobel Prize. These are some of the milestones.
And so what is the
in
difference?
The understanding of neurological problem, right?
So what is the difference between an MRI and a CT scan? I mean, if you
CT scan is a, if I tell you the full name of CT, computerized axial tomographic scan. C stands for computerized, A stands for axial, T stands for tomographic. It is an X-ray machine, but it is a computerized X-ray machine. It can take the images at different depth and planes in the body, which the earlier X-ray could not do it, which was invented in 1901. Mind it, the person who invented this X-ray in 1901 was also awarded the Nobel Prize. So it took them another 75 years from one milestone to another milestone in the history of neurosciences. In the history of neurosciences. So that was a plain X-ray, this was computerized X-ray, then the MRI does not require radiation at all. It's a
so
magnetic
it saves
field.
The patient in a way.
It is a safe, it's done in a magnetic field, magnetic resonance imaging. Now coming to the neurological problem, I was telling you about epilepsy. This is another common neurological problem. 5 crores people as on today suffer from this disease in this world. 5 crores. The next common problem that we see is the trauma to the brain and the spinal cord. You see many more, all these accidents now taking place like anything. It has become an epidemic in our country. In developed world, there are more automobiles, more vehicles. If you go to Germany, you will see, on an average, there are 3 members in a family. We have 6 members in a family in India, and they will have 5 cars in the family. But still they have got less accidents, road traffic accidents in Germany or America or in England or in Europe. You don't have so many accidents. In India, we do not have that many cars. We do have cars, but compared to the number of people, number of cars are not that many. But you see, every day hundreds and thousands of young people get affected by this road traffic accident. And most common organ that is affected in this road traffic accident or any trauma is the brain and the spinal cord. These are devastating, these are lethal. That's another common neurological problem we known as head injury or spinal injury.
Which is actually due to external factors.
External factor. Then next common neurological problem we see when we grow old, then what happens? There is a physiological changes in our body. Each and every cells in our body needs oxygen for their functioning, and other nutrients. To each and every cell in our body, oxygens and nutrients are carried through RBC, red blood
Red blood
corpuscles,
corpuscles.
which flows through the blood vessels, the tiny minute blood vessels. People say that if you make the blood vessels into one line that God has given us, it will reach the moon.
Yes, of course, yes.
It will reach the moon. We have, you can imagine, in this body we have so many lengthy blood vessels. So through this, the blood flows. As we grow old, there is a process called atherosclerosis. Because of that atherosclerosis, these small tiny blood vessels becomes hard and thickened. They become narrow and the blood cannot flow through them. As a result, there are two important things that happens in the brain. Sometimes they get blocked, sometimes they rupture and bleed. And these two conditions together are known as stroke. You know how common this disease is? 1 out of every 6 individual will have stroke during their lifetime. That means on an average we have 6 members in a family, and out of these 6 members, one or the other will get stroke in their lifetime. It's such a common devastating neurological disorder. It's a devastating neurological disorder and very common neurological disorder. We'll get opportunity to discuss about it. The good news is that it is by and large preventable if we can educate the people.
Which will actually
It's a by and large preventable malady. The next neurological disorder which we see commonly is the tumors in the brain. Like tumors or cancers in any other parts of the body, tumors in the brain is also quite common.
Does it start with a headache or something?
Right, that's one of the most common presenting symptom. That's present with one of the most common presenting symptom. She is also reminding me another important thing to tell you. Out of the most common neurological symptom, headache is another common neurological symptom. Probably all the audience sitting here, each one of you might have had headache in your lifetime. No? Nobody can say that I never had any headache. I do get headache, so also you will get headache. No? But there are some headaches which are very dangerous. There are some headaches which are not that dangerous. But headache is a common neurological disorder. Because it starts from the brain. Headache is connected to the brain, so it is a neurological disorder. Not all headaches are dangerous. We'll discuss it. We'll get more time to do that. Then what are the other common neurological disorders? Now, on an average, an Indian lives for up to 65 years. No? Average lifespan of an Indian, it came out in Times of India a couple of weeks ago. Average lifespan of an Indian is 65 years now. Do you know what is the average lifespan of an American? Do you know what is the average lifespan of an Japanese? An American lives on an average of 75 years. A Japanese lives for 78 years. We live for 65 years. As you grow older, the brain becomes vulnerable to some other specific neurological conditions like dementia or forgetfulness, Alzheimer's. Alzheimer's. So, it's a very common neurological disorder. Margaret Thatcher is suffering from Alzheimer's. Ronald Reagan, one of the most powerful personalities of this world, died of Alzheimer's. We also now, as we grow older, as we live longer, we become vulnerable to, these are known as degenerative brain disorders. Degenerative, these are Alzheimer's disease, these are Parkinson's disease, these are vascular dementia or stroke dementia. We become vulnerable to elderly people above the age of 65. The most common neurological disorder would be this type of disorder. So, if you tell me that for example, the common neurological disorder, these are the common neurological disorder. The disorders related to birth, congenital anomalies, resulting in delayed developmental milestones, both your cognitive means intelligence as well as physical development, then your infections, then your epilepsy, then trauma, tumor, stroke, different degenerative conditions, your headache. Then this is regarding brain. I am not coming to the spinal cord. There are many diseases which also affects the spinal cord. Suddenly one becomes paraplegic. Paraplegic means inability to move to both the lower limbs or paralysis of all the 4 limbs.
So is that
Recently-
sudden, all of a sudden, or
It can
it be?
start all of a sudden, depending on the causes. It may start suddenly, it may start slowly over a period of time. It affects the urine, it affects the passing of stool. This is disease of the spinal cord. Then coming to the peripheral nerves, many people complaints of tingling and numbness of the different parts of the body. These are problem of the peripheral nerves. We call it neuropathy or neuritis. So we call it neuropathy. It can happen for varieties of reasons. The most common cause is your diabetes. Diabetic will get neuropathy or neuritis. Alcoholics get neuritis. Many drugs and toxins causes neuritis. Many infections causes neuritis. Say for example the AIDS infection. AIDS infection, the most common neurological problem is a neuritis, right? Then coming to that, muscles, there are many diseases. There was a very nice story, we know that some of the people, children and even adults also, some of the muscles get thinned out, wasted. They are not able to walk, they are not able to move. We have some children, Duchenne children, they go to school, brain is fine, working well. There was a child couple of years ago in Guwahati, Don Bosco, who got latest marks in six subjects probably. He was a Duchenne child. Finally, he passed away. These are muscles disease. Many of the muscles disease are congenital because of the defects in the gene. And some of them are acquired because of some infections, toxins like that. So these are the different neurological problems. Common neurological problem.
This be easily identify this muscle disease,
Yeah.
or it takes time, it goes on and on, the parents couldn't identify and the patient is suffering.
Yeah.
Is it debilitating in the sense that the patient suffers for a long time?
Any medical problem, diagnosis depends on high index of suspicion. And also, see what my mind does not know, my eyes do not see. No? If I don't know, for example, I will tell you how ignorant we people are. I was trained and groomed in Guwahati as a doctor. I was in medical college for 14 years before I went for neurology training. In my 14 years of stay in medical college, Guwahati, I saw only 2 epilepsy patients all throughout my career. The common neurological disorder I was mentioning just now. I saw only 2. Now as a neurologist, every day I see minimum 10 to 15 epilepsy patients. Means in a difference of 40 years, I am able to see 40 neurological, 10 to 15 epilepsy patients alone, but in 14 years I saw only 2. It does not mean that
Epilepsy
there was no
exists.
epilepsy
Yes.
during those times.
That's right.
We did not know how to recognize epilepsy. We simply did not know. Public did not know that this could be epilepsy, we need to go to a doctor. So, awareness is very, very important. A program of this nature definitely would contribute a lot in creating awareness amongst the public how to suspect a disease.
And so in the quest of creating awareness, I wonder if any of our audience have any questions that could be pertinent to this program. Yes,
Good evening, sir.
Yeah.
Myself Hemanta Narayan Das. I am from director at CRT. So there are so many neurological problems, common neurological problems. But as a layman, how we could recognize this?
Absolutely, yes.
And
That's right.
how we can minimize it? How we can minimize it?
Yeah.
And also recognize the problem, yes.
How do you recognize neurological problems? Okay, fine.
Let's start off with headaches now.
Yes, sir.
For example, I mean, yes.
Like, because the headache is a problem which people don't take it seriously.
Yes.
And
And
we
earlier,
go for
sir,
self-medication especially.
And earlier
We
you
take
said something like benign and headaches and
Yeah,
something.
yeah,
So
yeah.
which are the signs probably to watch out for,
Yeah.
for a person who may be suffering from headaches or someone in the family suffering
Yeah.
from headaches?
In doctors, for safety of the patients, divide headache into 2 categories. They call it primary headache or benign headache or not very serious or dangerous headache. We call it primary headache. And other group is the secondary headache, which are very serious, one should not take lightly. Then how do you distinguish between
Yes, exactly.
the 2?
The distinction.
That's the main crux of the problem. Primary, benign or non-harmful headaches are usually runs for years together. Okay? I keep on getting it. It started in my childhood, it's continuing. Often when I get headache, I take an aspirin, I take an analgesic, I take rest, I go to bed, I sleep, I
Or
remain
perhaps
away
lack
from
of sleep, yes. That's
I remain away from
TV,
noises, TVs and all, and I become fresh next morning. Now, usually the benign headaches are, or the primary headaches are of that nature. If something is going on for years and years, we think that probably these are less harmful. Up till now, it is not causing much damage to the person concerned. Most common primary or benign headache is your migraine headache.
right.
Many people get migraine headache. What is migraine headache? Almost 15% of the population do suffer from migraine headache. So if we are 15 people here, at least one of us has a migraine headache. It's so common. It's more common in girls than in boys. The girls gets affected more than that. Then how it happens? Normally, usually, headache is on the one side of the head. Okay,
And
the
it-
character is throbbing in nature.
And the
They
intensity,
pulsate.
sir, the
Yeah.
intensity?
Yeah. Intensity is variable. Sometimes it can be very severe. Usually associated with vomiting tendency. Sometimes they end up by vomiting. Okay, and it is precipitated by exposure to sunshine, going to the market, or a journey,
Okay.
or a sleepless night, or a stress and tension of day-to-day life. They precipitate migraine headache. If they come home, sleep in a quiet room, dark room, cold environment, away from din and bustles, noises, they get a relief of it. They start in their adolescence and continue for.
Do you live with this problem for life as such? Or,
So there are two kinds of treatment for migraine headache for
or
us.
can it lead to something worse?
It does not. Usually these are benign. At some part of their life it disappears on its own. Suppose you get 3, 4, 5 attacks in a month, affects your day-to-day life and activities, then we intervene and give medicines. It can be treated. Okay? Suppose some gets migraine headache, it continues for 3, 4, 5 days. He cannot do anything. It's a big torture for the individual. Then there are specific treatment for aborting an acute attack. So there are two kinds of treatment for migraine headache. But when you go to a doctor, he will make sure that you do not have any other serious problem inside your head. He makes sure by doing a clinical examination, maybe by doing 1 or 2 investigation, then he makes sure that this is migraine only, nothing else. Then he will prescribe you medicine. That is one of the most common variety of neurological problem, that is migraine headache. In America, this is one of the most common cause of man-day loss in office.
Mandate's loss, yes.
Because they are the women and men equally employed. In any organization, you will see more women employees. They get it more. That is one of the.
So are migraines, migraines gender specific then, as you were saying, because you tend to repeat this.
See, it's more common in girls than in boys, but it is seen in boys also. For example, around 8 to 10% of the boys do suffer from migraine, around 17 to 18% of the girls suffer from migraine. If you make it two together, average, I am telling you that around 10 to 15%. Okay, but girls, the incidence of migraine.
Why is that exactly, sir?
It's to some extent genetic, to some extent your neurohumoral mechanism, which is little different in females than in men. Okay, so that's
Anything related to lifestyle, sir?
lifestyle, those people who are more prone to stress and strain, emotionally labile, those people are more prone to get migraine headache than others.
Now, sir, is it true, or maybe correct me if I'm wrong, but having certain headaches in certain areas of a brain could be specific to a certain organ? Is it?
I think I'll answer that. Before that, let me tell you, complete your primary or non-harmful headache.
Non-harmful, yes.
Migraine, I told you. Second common primary headache, which is not that dangerous, is your tension type headache. We call it.
How does that happen?
How to
That is
identify
lifestyle
that?
really. Yes.
Tension type headache. In tension type headache, what happens? I told you migraine is on one half of the head. No? In
Yes.
chronic tension headache, it is around the whole head.
Okay.
More common in the back of the head. You feel as if somebody is pulling
it.
from behind. You never feel free. You feel the heaviness about the head. And morning you remains free. As the days advances, your headache keeps building up. Okay? keeps building up. Suppose you have an unfavorable atmosphere in your office, you don't like it. You go to office and you start getting headache.
Okay.
So it's almost psychological.
Tension. Tension builds up. It produces that.
But it's
Tension.
not harmful.
Not harmful.
Okay.
We call it chronic tension. It's one next to migraine. This is most common cause of headache. Lot many people get it. They have some problem in their subconscious mind. They are not able to resolve it. It may get manifested as a headache. That is called chronic tension headache. And that's the nature of the headache. It runs for years together. That is second variety of tension headache or chronic tension headache. It has been, there is treatment for it. And the third type of headache that is commonly seen is called cluster headache. Cluster headache is very painful, very severe. Males are more affected than females.
Oh, this is again
one
the other
headache.
way around.
Oh, the other way around.
And how is
Usually
this?
starts at the middle of the night. It's so severe headache, he will bang his head against the wall.
It is not a migraine.
Not a migraine. And at the time of headache, there will be watering from the one eye. It is one side of the head usually. There will be watering from that same side of the eye. Eye will become red, and there will be sweating from that one half of the head and face.
Okay.
This is called cluster headache. Males are more commonly affected. It usually starts at the middle of the night. Okay, very severe headache.
And neither is it tension related.
No, not related to tension.
Okay.
Not genetics also. Okay, there will be watering from the eye. There will be sweating on one half of the face, on the side of the pain, and there will be redness of the eyes. Very severe, very excruciating headache. Okay, why we call it clusters? It may continue for days together at a stretch, then you get relief of it automatically. Then for 2-3 years, 4-5 years, you may not have it. That's why it comes in clusters. Clusters means group. It comes in clusters, then disappears, then again it comes. There are medication for it.
And the gap is always the same?
No, variable gap.
Okay.
Variable gap.
It could be often or it could be rare.
Yeah. So that's how this is called cluster headache. Then another common primary headache, which is non-harmful headache, is your psychogenic headache that you were telling. Is it psychological headache? So there is a specific variety of psychological headache.
The term is psychogenic.
So we call it psychogenic headache. We can make out when you come to me and tell me about your headache, describe your headache, I can make out whether it is a real genuine problem or a psychological problem. But even if it is a psychological problem also, it is a problem for you, problem for a patient.
True, for
We
the,
need
for
to
the
address
individual,
that.
yes.
But what is the character of the headache? Normally they will say that I am having pain here, vertex,
On the top of the head.
and it's continuous 24. If we ask him, do you get headache 24 hours of the day? Yes, 24 hours. Do you get it 7 days of the week? Yes, 7 days of the week. Is it for 365 days of the Yes. Okay, can you eat? Yes, I can eat. Can you sleep? Yes, I can sleep.
So the normal functions can be carried out.
So that is a psychological one.
Psychological. But he keeps complaining that I have headache, I have headache. He cannot, I have headache. You need to treat them. So anybody coming to you with a problem, whether it is a psychological or organic, it's a problem for the individual.
And so for the psychological headaches, is it effective, the allopathic treatments that one might have?
We help them, we can treat them.
And now I think we
can
have
treat
someone in the audience who's going to ask a question. as well.
I want to put a question, sir, you regarding the epilepsy. Can epilepsy be cured by surgery, sir?
them. It's a very good question you have asked me. First is I told you that it is one of the most common neurological problem. Recognition of the epilepsy is a challenge. Many people do not know that how epilepsy present, number one. Number two, even many doctors also would not know. These were not written in the books that they had read in their training. So these are new concepts coming up. These are new areas of neurosciences. Then, there are medicines for treating epilepsy. 50% of the epilepsy can be cured once for all with medicine. 50% of the epilepsy.
So there are hopes.
Sure. There are 50% of epilepsy can be cured once for all with the help of medicine. Another 25% of the epilepsy can be kept under control with adequate medication. Control means, what is the difference between cure and control? The doctors keep on using it. Cure means you take a course of medication, your disease is gone forever, you are free. This is cure.
And
Most
you
of the
need
infections are like that.
And you need not take the medicines.
You did not continue the medicine. Control means so long you take medicines, your disease remains okay. As soon as you withdraw the medication, the symptoms comes back. There are many diseases, not only epilepsy, for high blood pressure.
True.
You need to take medicine lifelong.
Yeah.
Lifelong. There where many people make mistakes. Blood pressure becomes normal, he stops medicine. You would not know that it has come up again. So once you are hypertensive for life. Once you are diabetic for life. So treatment is lifelong. It may not be pills always, it may be something else also. I will discuss it in a later part
And
about
so we
here.
have another question from the audience.
So then the third, you said about surgery. So I told you that 50% can be cured with medicine, 25% can be controlled with medicine. What about the remaining 25% who cannot be helped with medicine alone?
Yes.
They are the one who can be helped by surgery. They are the one who can be helped by surgeries. Unfortunately, to help this large number of people, not enough infrastructure has been built up. It's a very highly specialized area of neurosciences. It's a very highly specialized area of neuroscience. It will be available in Guwahati also, probably at GNRC in next couple of months' time for the people of the entire eastern India, because this facility is not available in Northeast, in West Bengal, in Bihar, in Orissa, in Chhattisgarh, in MP, in UP, epilepsy surgery is not being done. Okay. So if we develop it, it will be first of its kind. So that 25% of the patient who cannot be helped by medicine can be helped by surgery. Some of them may not be eligible for surgery. I must also tell you, though you have not asked me that questions, then how you can help them? There is a procedure called vagal nerve stimulation. It's a small equipment equal to the size of a wristwatch, like a pacemaker. The 25% of the epilepsy patient who cannot be helped by medicines can be helped by surgery. Unfortunately, it was not available to the people. Now it will be available with time. Things develop quite fast sometimes. So a large majority of them, of those 25% can be helped by surgery, and the remaining ones who would not be eligible for surgery can be helped by a procedure called vagal nerve stimulation. Vagal nerve stimulation.
So could you describe a little more about vagal nerve stimulation and how does it help?
Okay, vagal nerve stimulation is it's a implant which generates some impulses, stimulates the vagal nerve, and that has an inhibitory effect on the electrical impulses that comes out of the brain, which produces epilepsy.
And which produces the seizures, I believe, leading to epilepsy. And now we have a question from the audience as well.
And Zakir Lala. So exactly there are some problems to identify the actual reason of the for migraine actually. We have been suffering from long time. One is suppose eyes problem and another tension for
headaches relating to eyes or something like
and
that.
And also suffering from another nose problem actually. This is there are some problems also for doctors also. They cannot recognize and to prescribe what actually the reasons for his headache. Actually, headache is migraine. Is it a migraine actually? As we are feeling pain in our head actually.
Yeah, it's a good question you are asking. Say for example, I'll tell you as a doctor, when I was a student in medical college 40 years ago, how did we treat my headache patient? Once a headache patient will come to the medicine OPD, we'll check his blood pressure. I'm telling you the difference of medicines, medical approach 40 years ago and today. Okay, we'll check the blood pressure, right? Suppose the blood pressure is normal, then we'll send him to the ENT OPD. He will end up by having a diagnosis of sinus. So headache became synonymous with sinus. So many patients who come to me for their headache, they will start with sinus. If I ask them, what is your problem? Doctor, I have sinus.
That is what the patient supposes.
The sinus means for them it is headache, because for so many years they were being treated as a sinus, paranasal sinusitis. Okay, ENT doctor treats them. Then suppose he does not become all right, then ENT doctor will later on send him to an eye doctor. Eye doctor will end up by giving him a specs. Whether it is needed or not needed, these are primitive medicine. That's how they had practiced. Okay, because the knowledge was not enough, awareness was not adequate, technology was not available. That's how they treat it. And many of the doctors still treat them like that. But things are changing. Okay? So headache could be because of an eye problem also, that is true. But we need to make sure that is it really because of an eye problem? And if it is so, treat him for the eye problem. Is it because of a sinus problem? If it is so, treat him for sinus problem. And if it is migraine, the headache of all these different causes would be different. A person who is trained in managing headache, a doctor, he will be able to distinguish between the three varieties. But a doctor who has not been trained adequately for that, he may not be able to do that. So that problem is not there nowadays. Treating. I think when you have raised the question of headache, I kept one probably issue incomplete, the primary headache or benign headache and the dangerous headache. Dangerous headache. That you should know when a headache is dangerous and when you should not take it lightly. Okay? When you should. Sudden severe bursting headache. Very severe headache suddenly coming, which you have not experienced in your life before. I am telling you, migraine is chronic, tension is chronic, you keep on getting it, psychogenic is chronic headache, cluster is chronic. No? That means you had more than one episodes in the past. They come and go, right? This headache is sudden, severe headache. You have never experienced in your life this type of headache before. Never take them lightly.
Does it start from a point?
It can start anywhere.
But then it could be confused with cluster headaches, like you were telling a little earlier.
But if cluster would be chronic, repeated headache. These are repetitive headache. This has come for the first time in your life.
So you have to wait for the next time? Like
no, don't wait for the next time. Don't wait. When you get it for the first time, don't make a diagnosis of migraine, don't make a diagnosis of cluster, don't make a diagnosis of tension or this. When you have headache for the first time in your life.
So that is a common thumb rule, I would say?
Yeah, common thumb. When you have headache for the first time in your life, always consult a doctor.
So for the benefit of the viewers, if you do have a headache,
for the first time in your life,
you should go and consult a doctor.
I am not telling you chronic headache means which you are having it for years together, not getting better, it comes and go. Those are chronic problems. Okay? If you have headache for the first time in your life, which you had never had it before, always consult a doctor. You know why? Most common cause of this type of headache is a bleed inside the brain. Sudden severe headache, with or without vomiting, with or without loss of consciousness, with or without any neurological symptom. Okay? Never ignore them. And if it is associated with fever, some tightness and pain in the back of the neck, always think of a brain infection. Then brain infection could be meningitis, could be encephalitis, which we see so many encephalitis patients. It could be cerebral malaria. Okay? That sudden severe headache, if it is associated with fever, if it is associated with pain over the back of the neck, think of brain infection. Never take it lightly.
Is this kind of severe headache curable somehow?
Oh, I'll come to that. Okay? Then you think of it, right? Then if your intensity of headache keeps on increasing day by day, and if you feel that the headache always becomes more in the early morning when you are still lying in bed, think of a brain tumor. Okay? See, other headaches can come. I told you that migraine can come anytime. Tension builds up as the dose advances. Cluster comes at the middle of the night. Psychogenic 24 hours of the day. These are interesting observations.
Yes, absolutely.
Yeah, right? But a brain tumor headache, the headache may be the first symptom of brain tumor. You had told me probably. So if it is a headache of brain tumor, usually starts early in the morning when you are still in bed, around 4 or 5 in the morning. 4 or 5 in the morning. And every day the headache, it's a continuous headache, they keep on increasing. And later on there may be some other symptoms like vomiting, maybe weakness of one half of the body, maybe black spots in front of your eyes, then feeling of unwell-being all the time. These are some of the symptoms of headache due to tumor. So I told you headache because of a bleed in the brain, which is a life-threatening illness, needs medical intervention as quickly as possible. So sudden severe headache associated with vomiting or no vomiting, if you never had it before in the past, always think of a bleed or a stroke. Always bleed or a stroke. That comes like lightning. Okay? Comes like lightning suddenly. Then the headache, very severe in intensity, associated with fever, associated with pain in the back of the neck. Think of a brain infections, meningitis, encephalitis, malaria, cerebral malaria. Think of those things. Then headache starting early in the morning, and gradually problem is becoming more and more, not going away with an ordinary analgesic. Think of a brain tumor. Think of a brain tumor. So these are serious, devastating brain problem where the first symptom may be only headache. So headache is a subject of the neurologist. We don't have enough neurologists, unfortunately. I'll tell you, in America, there are one neurologist for every 20,000 people. In the Northeast, you have how many? 50 million people. Now you have 10 neurologists. So against one neurologist for 20,000, you have one neurologist for 5 million people. Definitely, seeing a neurologist is a big affair here now. Big affair here. You don't get them. An ENT doctor is available easily. Eye doctor would be more in numbers. But you don't have enough of neurologists. And many times you also do not know that headache is being treated by a neurologist. Those are some of our public awareness issues or challenges in front of us. Yeah, that's why probably you had suffered. If you had been to a neurologist, you would have recognized it as a migraine on day one and he would have given you treatment. Right?
And then we have another question from the audience. Yes.
Sir, good afternoon, sir. Myself, Mohammad Munir Hussain. I am a pharmacist. Sir, I would like to request you explain regarding autonomous nervous system disease, sir. Is it also included in the neurological disorder, sir? And also, sir, is there any lifestyle or working pattern which are contributing to the neurological disorder or disease, sir?
Autonomic nervous system, autonomic means what? It's not under your voluntary control. Okay? Say for example, can you stop your heartbeat on your own? You cannot, right? Can you stop the movement of your intestine? You cannot, right? You cannot. So, the nervous system which controls the movement of the certain organ which is not on your control are known as autonomic nervous system. Entire body is controlled by the nervous system, the kidney, heart, lungs, intestine, skin, muscles, all. Okay? All hairs are controlled by this. The nervous system is just like the Prime Minister in the Council of Ministers. The respiratory system, cardiovascular system, kidney and all, if these are all independent departments, but they are controlled by the PMO, Prime Minister Office. No, they are all answerable to him. In the same way, all the organs of our bodies are answerable to the nervous system, brain and the nervous system. They are supreme. Okay, and in that there are certain organs or functions in our body which keeps on working without your control. You cannot control it. Say, you cannot make the heart to stop just because you don't want. Otherwise, there would have been catastrophe. Sometimes you will forget, na? Okay, switch it on, then you are finished. So God has created the system in such a way, the organs which are essential, even before we are born, heart starts beating. And they keep beating. Once the heartbeat stops, you are finished. Okay? And this is controlled by the autonomic nervous system. Sometimes this autonomic nervous system not only, suppose you are frightened, you are excited, you are angry, heart rate increases. That's the effect of autonomic nervous system. You are angry, but you cannot keep your heart rate down, the pulse will automatically rise. Suppose you are frightened, what happens? Your hairs become when you are frightened, eyes become big. Right. The actors can make it frightened like this. These are all phenomena controlled by the autonomic nervous system. Okay? There may be some problem in the autonomic nervous system also which manifests as disease. Blood pressure is maintained by the autonomic nervous system. Okay. Those people whose autonomic nervous system is affected, sometimes they have sudden fall of blood pressure and they drops down. That is called post-cerebral hypotension. Okay? There are some diseases which affects the autonomic nervous system also. Then what was your next question you said?
Is there any preventive measure?
Lifestyle you said lifestyle diseases, lifestyle, yeah. There are many diseases which are related to your lifestyle, right? For example, stroke is a lifestyle disease. It's a very common problem. It's a devastating neurological problem. 1 out of every 6 individuals in this world will get stroke in their lifetime. No. But also one statement I made at the beginning of the discussion, that good news is that it is by and large preventable.
Yes.
By modifying your lifestyle. How do you modify your lifestyle? What are the important things in your lifestyle? Say for example, we all are busy in some works, no?
Yes.
I am a doctor, there and Korar, you have some professions. So keep some time every day for walking.
Okay.
Change your lifestyle, okay? Work fine, but out of the 24 hours, 8 hours for sleep, keep another 1 hour for walking every day.
Physical exercise.
One, that is lifestyle changes, okay? Walk 1 hour every day, right? That will keep away heart attack, that will keep away stroke, that will keep away hypertension, that will keep away diabetes, right? That is lifestyle modification. Then 2, when you, in your diet, always include some green vegetables, okay? Nowadays, youngsters will like pizza, na? So many Pizza Huts are coming up in Guwahati.
Right.
Now, Kentucky chicken fry is also coming. Another day, McDonald's will come. All American
So how does he
children-
balance the two then?
all American children are having problem for eating this fast food.
Obesity.
Now, you are also catching up very fast. Our children are also catching up. But make sure that these children learn to consume some green leafy vegetables every day as a part of their diet. This is lifestyle changes. Okay? We have to enforce it. This will keep away diabetes, high blood pressure, stroke and heart attack. These are called lifestyle diseases. Okay?
So
Then-
walking will do, or doing exercise and yoga will also help us?
Oh yeah, yoga also helps you. That's very good.
But then there's something called intensive exercises and moderate exercise. How do we make a
Yes.
distinction then?
How? No, when you exercise means walking, I am telling you, that's
Yes.
easy, na? You don't need a gym to do that.
Now, say supposing somebody as starting out who's trying to make an effort in lifestyle changes.
Yeah.
Now he cannot do 1 hour walking on the very first day.
Increase it
What is-
slowly.
what
Increase
is
it
a
slowly.
common recommendation?
Normally, for Indian people, you need 1 hour of walking, brisk walking when you sweat.
Okay.
Okay?
But for how many minutes does he start off with?
See, it depends.
Initially, when he started.
Initially, see, there is no hard and fast rule. Do till you are able to tolerate or cope it up. Say, for example, start with 20 minutes or 25
gradually
minutes.
we
So that
should
is the
go.
threshold, I would say.
Threshold, then slowly increase it.
Increase it.
Slowly increase it.
Because perhaps going for 1 hour on the first day could be
He may not be
detrimental
able
to
do
health
it.
actually.
Finally, you should end up by having at least 1 hour of walking every day. I came to the diet, I told you, green vegetables and some fruits also include in your dietary regime.
Okay.
3, if you are smoking, say no to it from today.
Absolutely.
No smoking. Okay, that's a lifestyle. Smoking is a lifestyle.
And so
now.
what about the tobacco pouches that people have?
That same tobacco pouches are also equally harmful. Okay, any form of tobacco is harmful for the health. Say no to it from today. Okay, smoking is a lifestyle problem. Silence. No, it does not help anybody. It harms everybody. So no to smoking. If you are taking alcohol, keep it within 2 packs in a day. If you are not drinking alcohol, don't start it.
Right.
Okay? Don't start it. If you are not drinking, you don't need to start it. And if you are drinking, keep it within less than 2 packs.
And nowadays people are depending very much on fast foods.
So fast food is harmful. And if you do these 3-4 things that I told you, your obesity comes down.
Right.
Right? Obesity comes down. Then 20% of the people in the community are hypertensive. They don't know about it.
Yeah.
They don't check blood pressure.
Right.
So check your blood pressure once in a while, at least once in 6 months, those who are not hypertensive.
And those who are?
And those who are hypertensive, at least once in a month, they should check their blood pressure and take pills prescribed by the doctors on a regular basis.
So monitoring the blood pressure is
Monitor the blood pressure and take pills as per the advice of your doctor.
And so we have another question from the audience as well.
Good afternoon, sir. I am Faizur Rahman Borah, Warehouse Manager in the Department of Assam State Warehousing Corporation. I would like to ask you about motor neuron disease and its symptoms and whether it is curable, treatment.
What is motor neuron disease? Well, briefing you about the nervous system, I told you that you have the brain, you have the spinal cord, you have the peripheral nerves, and you have the muscles, right? In motor neuron, where are these motor neurons are? In motor neuron disease, these anterior horn cells get affected. It's a degenerative disease of the nervous system. It's a degenerative disease of the nervous system, not because of any infection. The medical science till today has not been able to find out the real cause for this particular malady. Hundreds and thousands of scientists all over the world are working for it to find out the cause for this disease.
Okay.
If you understand the mechanism of the disease, including the cause, then next step is to find out work for solution.
True.
Still we don't have the cause up till now. For so many years, we have not been able to find a cure for it. One medicine that was being tried has been found to be slightly effective, means it delays the progress of the disease. If you things will happen in 3 years, it might delay it for 5 years.
So what are the physical manifestations of this?
The motor neuron disease physical manifestations are, finally it affects the muscles, comes to the nerve, then it affects the muscle. So there is thinning of the muscles. Sometimes the hand muscles, they get thinned out.
Okay.
Sometimes the body trunk muscles get thinned out. They keep trembling or shaking. We call it tremor or fasciculation. So mainly thinning of the muscles, tremor of the muscles, they become weak, and it continuously progresses. There are different varieties of motor neuron disease depending on symptoms varies. Sometimes the symptoms may start in the face, swallowing and speaking problem, right? Sometimes they may start in the arms, sometimes may start in the legs, like that, depending on the different varieties of motor neuron disease. Unfortunately, other than symptomatic and supportive treatment, we don't have specific therapy for this particular condition. But there are hundreds of scientists who are working for it day in, day out. Any moment there can be some solution sometime.
Okay.
So far,
Any
sir, it is debilitating.
debilitating disease, right.
And then we have another question from the audience, yes.
So my question is, what are the neurological manifestations of AIDS?
We do not have specific therapy for AIDS up till now. We have medicine which are quite expensive, can delay the progress of the disease, but better than motor neuron disease. We don't have cure for AIDS. It cannot kill the virus. But then the most common manifestations are what is AIDS means what? It destroys the immune system in the body. What is the function of the immune system? Immune system is the defense force. They protect, defend us from our enemies, no? So our God has given us a defensive system in the God is great. I being a doctor, I don't worship, go to temple, but God is great. He has given us a defense mechanism in our body that is called immune system. This AIDS virus destroys this immune system. As a result, we become vulnerable to infections, and that infection sets in most commonly in the brain. So the common manifestations of AIDS in that in a human being are the new different types of brain infections. They call meningitis, okay? TB meningitis, fungal meningitis, it's very common. That is one infection, different kinds of brain neuro infection. And second is a neuritis, I told you, neuropathy, tingling, numbness, weakness of the extremities, that's how they can present too. And in the later part of the illness, they may go for dementia, means their memory will get lost, they will start forgetting, they will lose the rationality, power of thinking and reasoning and all these. Age dementia you call it. So those are the common manifestations of age in nervous system.
Why did you select this field of medical field?
Okay, right.
A good question.
Why I wanted
indeed.
to become a neurologist. My nature is to always start out in areas, in those areas where nobody has ventured into. There are elements of uncertainty, there are elements of risks, but that always excites me. I'm not only a doctor, I'm also an entrepreneur, that's my nature. Okay, I always take risk. So also in neurosciences, I got opportunity to study cardiology and neurology also. I had to select one of them. I decided to go for neurology. It was a hidden treasure, nobody knew about it, all these good equipments were not available. when I was undergoing training in neurology in All India Institute, can you imagine there was only one CT scan in the whole country, whole of India.
So you
So
had to
we
find-
were treating and diagnosing all these neurological problems without these machines. We had to treat it that way.
Now,
Huh?
how advanced is it? Like medical equipments are available
It's now,
everywhere?
see, the challenge before us is not the availability of technology. The challenge before us is, for this country, is the affordability issue.
Okay.
True.
Okay?
Absolutely.
Affordability issue. See, large majority of the people, see, many of the medical facilities that is available in this country is at par with America. No difference. Many people from America comes to India to get treated nowadays, right? But unfortunately, painful thing is that large majority of the people cannot afford this technology.
Right.
Good medical care means what? Good doctor, good nurses, good equipments, good medicine. Any good things are expensive, no? They have to pay for it. In countries like America, 85% of the populations are covered with insurance. So they get it, only 15% do not get it. So they can make arrangement for it. In our country, less than 2% of the people are covered with insurance. 98% has to manage it on their own. Such a big problem. In Canada, each and every citizen is entitled to get quality health care as a part of their constitutional right. Each and every citizen in UK are entitled to get quality health care as a part of their constitutional system through national health services. But not in India. Our problems are
Problems are there. But we
finding
are,
out a mechanism how we can make it available and affordable to the common man. Without solving that issues, we will not be able to create an equitable society so far as the healthcare is concerned. That's what I understand and realize as a doctor.
Now, for a patient to have a cooperation with the doctor, what would be expected of a patient to reveal to a doctor and for the doctor to diagnose the illness properly and then have a overall output of the health?
See, that brings in the issue of doctor-patient relationship. The relation between a patient and a doctor is based on mutual trust, respect, confidence, love and affection. Unless the doctor has got a genuine love and affection for an individual, he cannot be treated properly. It is one human being taking care of another human being.
exactly.
It's not a carpenter taking care of a chair or a table, right? It's not a mechanic taking care of a Maruti car. No, it's a one human being taking care of another human being. So when I tell you that this relationship is based on trust, respect, mutual confidence, love and affection. So it is mutual. The patient must love the doctor, so also the doctor must love the patient. The doctor should be trustworthy, so also patient should divulge all the information to the doctor.
True, absolutely.
Otherwise he will not be able to make a
Correct
diagnosis. In the same way, whatever confidence that the patient has with the doctor, he should not divulge it for any reason.
To someone else.
Okay, for any reason. He should, for any commercial interest, for any political interest, whatever information is available to him, a doctor should not divulge it or utilize it. Right? In the same way, whatever advice is given by the doctor, patient must try to follow it. If there is a genuine problem in following the doctor's advice, he should get back to the doctor and tell him, doctor, look, you have given me this medicine. Either I cannot tolerate it or I cannot afford it. Do you have an alternative? Do you have an alternative? So, this is needed. It's a very sacred relationship between the doctor and the patient. It's a very unique relationship and both should respect.
So coming down to the human level, now doctors are humans too, and this is something as patients we always overlook. We always go to a doctor saying that he will cure us, he's the person to be there, but after all you are a human being as well. So how do you deal with long working hours, the stress levels that are built up and people coming to you in sickness? You do not deal with people who are in a positive state of mind. You are actually there to look after them, as a matter of fact.
To become a doctor is a mission. It cannot be a profession. If your mission is to give a healing task to a suffering person, that won't make you tired, that won't make you irritated or annoyed. Rather, it's an inspiration in your life, right? It's for a doctor who takes this as a mission in his life. So there are three kinds of doctor, I must tell you as a doctor also. You have bad doctors, you have good doctors, you have gifted doctors. Okay? A gifted doctor will never get tired by whatever comes to him from the patients. He never gets annoyed by the patients. He never feels that caring a sick patient is a burden to him.
True.
Okay? A gifted doctor. But unfortunately, you do not have too many gifted doctors in this world. He never gets annoyed. I'll tell you one thing. If you ask me, are these patients always right? I would say that probably not. A patient may be over-demanding, patient may be unreasonable, patient may have many other things. But a doctor needs to be kind and caring while dealing with a patient. One should remember it. Many doctors may not do that. There is the problem. Conflict. Violence, all those things keep happening. What we need is that we need more and more gifted doctors in the society.
Yes, sir, and thank you so much for your inputs, and with this profound advice, we'd like to conclude this program, and we'd like to thank sir for being with us and sharing your precious inputs with all of us and with the viewers. And of course the viewers, we'd like to thank you for coming and participating in this program as well. Thank you so much.